Hi, my name is Dagmar Ehling, and I'm one of the practitioners here at OHS. And today I'm going to present to you a little educational series on seasonal allergies, herbal remedies for home use. And I just want to mention to you that in Chinese medicine, all treatments are typically custom tailored to the patient's specific presentation. This video only addresses general suggestions, and it's for educational purposes only. Please don't use any of the herbs mentioned here in this video before checking with your practitioner, especially if you're pregnant or if you take prescription medications. So first I want to talk to you about some definitions in Chinese medicine. We want to define what airborne pathogens are and how that's viewed in Chinese medicine. So an airborne pathogen can be pollen, a virus, a bacteria, a mold, a fungi, which is a mold, and then it can also be dust mites. So any airborne pathogen essentially attacks the body, and in Chinese medicine we differentiate that attack as either a wind cold or a wind heat pattern. So we're less concerned with what the actual pathogen is, but we are concerned how that pathogen affects the patient, because there are airborne pathogens that cause disease in some people but not in others. So why? What is it about the terrain of the person that gets sick versus the difference in terrain of the person that doesn't get sick? So those are the questions that we're asking in Chinese medicine. So in a wind cold pattern, we will see symptoms like aversion to cold, aversion to wind. We're going to see chills greater than fever. There might be a stuffy nose, a scratchy throat. There'll be body aches and neck pain and maybe a headache. Whereas in a wind heat pattern, we will see just the patient will feel subjectively hot. There will be irritability. There may be fever greater than chills, and there will be a headache, neck ache, and body aches. And there will also be a sore throat this time, and potentially with enlarged lymph nodes. So those are the different patterns of how it can manifest. And then the treatment strategy is to induce sweating or cause diaphoresis, which means that if the external airborne pathogen invaded the body, we want to open the pores and allow the pathogen to escape the body. Okay, so that's a simple strategy. And then if the wind invasion is not treated in its acute phase, then it could move further into the lungs, causing either phlegm damp or phlegm heat. And in a phlegm damp pattern, we would see white or clear phlegm that is either easy or difficult to expectorate, whereas in a lung phlegm heat pattern, we will see more yellow or green, or if the heat is severe, we might even see blood-tinged phlegm. And the treatment strategy, again, if there is still wind present, we want to induce the sweating. And if obviously for the phlegm damp and the phlegm heat, we want to use herbs that will resolve those patterns specifically. And those herbs are different for each manifestation. I do want to give you a quick overview how Chinese medicine views fluids and phlegm and mucus, because it's very different than how Western medicine views it. So we know that the human body is 70% water. And we know that nutrients need to be delivered into the cell and waste products need to be removed out of the cell. And so that is healthy physiology when that give or take happens in the cell. But then when we have an airborne pathogen, the fluids may become a little turbid. So a symptom of that might be that it's a stuffy nose. Then if we fail to treat in the turbid water phase, then it may turn into dampness. And then maybe damp heat or damp cold. And then the patient may present with a runny nose, cough with phlegm expectoration, and then if the dampness is more in the digestive tract, we will see a slow metabolism and poor nutrient uptake. So those are all potential patterns. And then if the dampness is not treated in the right phase, in the current phase, then it may further progress into the phlegm or phlegm nodulation phase. And of course, we have a phlegm damp or phlegm cold and phlegm heat phase, so either one could be happening for the person. So now we would see symptoms, as an example, where the dampness is congealed into this really sticky and dense phlegm in the lungs. There could be a mucocele. There could be, if it's already progressed to like a little hard tumor, like, a cyst or a nodule, there could be like nasal or sinus polyps. And then if the phlegm is not treated at this phase, then the phlegm can turn into a stone or calcification seen from a respiratory aspect, seen in tonsil stones. So those are just some things to think about. And the goal is always, in whichever phase the patient is in, to return the patient to clear fluids. So if they're in turbid water, to return to clear fluids. If they're in damp, then we will return them to clear fluids or phlegm and so forth. And once they're in the stone phase, it's going to be pretty hard to resolve the stones, because then we're dealing with something very substantial and very dense. And sometimes herbal medicine isn't strong enough to resolve that. So it depends on the specific patient situation. So we also need to make sure we have an optimal diet and optimal digestive tract. Those of you who are OHS patients, you know that we always talk about blood sugar with you. We know that we want to make sure that the blood sugar levels is always even 24/7, because the brain needs the most glucose in the body. And if we're either insulin resistant with symptoms such as fatigue after meals or crave sugar after meals, or if you're a meal skipper, then you may have reactive hypoglycemia. Both insulin resistance and reactive hypoglycemia are very inflammatory and may set the terrain and the environment in which allergies can happen. So we want to make sure that in order to fix the hypoglycemia, we want to make sure that you're don't have blood sugar problems, and that your diet is such that you don't have that. Then we want to make sure to consume lots of warm and cooked foods about 80% of the time, though that may vary depending on your particular presentation. Because when we eat cold cereal for breakfast, wash it down with orange juice that has ice cubes in it, and with some greasy cheese or whatever, and then we may have a cold salad for lunch, washed down with ice water or iced tea or iced coffee or something like that, and maybe hopefully the person might have a hot dinner. Those kinds of diets are just really crucial in causing damp and phlegm accumulation. And so we really want to make sure that if you keep your digestive tract warm, all the digestive juices are flowing better, and you have better nutrient absorption, and you will not have as much damp and phlegm. You also want to explore whether or not there are food sensitivities or food allergies, true food allergies like IgE mediated. You want to see if there are any parasites, any opportunistic bacteria, whether or not there's gut dysbiosis or some permeability issue or leaky gut problem. So those are all things that we want to explore for people with allergies, because those have to do with the terrain in which the allergies occur. And this is something that Chinese medicine does in general. We always fix the terrain so the symptom just fades away. So that is very different from how Western medicine treats things. The first herb that we want to talk about is ginger tea, shenjiang. We want to use ginger tea in a wind cold situation. So you want to use about 3 to 5 slices of ginger per cup of water, bring to a boil, simmer for about 10 minutes, and then wrap yourself in clothing, warm clothing or hot, warm blanket, or turn up the heat, whichever. And then you drink the tea while it's still warm. And then the goal is to induce that mild whole body sweat to release the pathogen, to push out the pathogen. You could also take a hot bath while drinking ginger tea, or do a sauna. And then as a side benefit, ginger tea can also be used for nausea, typically in patients who are either anxious or people who, and so their stomach kind of constrict and they have a low appetite and they just don't really want to eat or are nauseous. Or ginger tea can be used for those people who just have the sensation of food sitting, like they eat a meal and then food just sits. So obviously we want to explore why else somebody may have chronic nausea, but in an acute situation, as I described, it would be appropriate to use ginger tea. Peppermint tea, boha, grows great in the garden. We have a lot of it. It grows like a weed. So it's used in a wind heat situation. You want to use about 8 leaves if you have a fresh source for it, or you use 2 peppermint tea bags in an 8-ounce mug, and then let it steep until cool enough to drink. And it will release that wind heat and provide that whole body sweat, a gentle whole body sweat, so you can release the exterior. And then peppermint also is great for bringing superficial itchy rashes to the surface, like those kinds of rashes that come and go very quickly, and they move around very quickly, and they're itchy, and Chinese medicine calls those rashes a wind rash. And in Western medicine, it would be like hives or urticaria. That would be the term that Western medicine would use. So peppermint is useful for those kinds of rashes. Chrysanthemum juhua is used in a wind heat situation affecting the eyes. The eyes here are red, itchy, while the person is moving through the allergy season. You want to use about 1 tablespoon in an 8-ounce mug, steep for about 10 minutes, and then you can drink the tea and or dip one of those round cosmetic pads into the tea for a moment, and then just put it on your eyes and rest with it as a warm compress. You can get chrysanthemum tea either at the office, we have it as a bulk herb, or you can also purchase it at a Chinese food store. So either way, you can get it there. Magnolia Buds, Xinyi same thing. We have it at the office, and you can buy it at a Chinese food store. Use it for wind cold causing sinus and nasal congestion with a runny discharge. And then that's a clear discharge, not a yellow one. And you use 1 tablespoon in an 8-ounce mug, steep for a few minutes, and then you drink the tea. Or while the tea is still being cooked, you can drape a towel over the cooking pot and then just inhale the steam, and that will also clear up your sinuses and your nose. Then we have, for those of you who are familiar with the cold and flu kit, we have Ganmao Ling. Ganmao Ling means common cold in Chinese medicine, Ganmao. It's used for wind cold and wind heat. It opens up the nasal passages, and it resolves white and clear phlegm. It can also be used for those associated symptoms of stiff neck, headache, sore throat, mild chills and fever, ear pain, swollen glands, and sinus congestion. And it's best during the acute phase, during the first 48 hours, but sometimes can also be utilized later on. And then the next remedy is Biyan Pian, and that's used for wind cold leading to acute and chronic rhinitis or runny nose with excessive sneezing, and this runny nose is clear, and a postnasal drip. So this is a great remedy for those people who have exactly those symptoms. Peppermint Kanwan is used for wind heat, wind cold, causing thick and more yellowish and yellow nasal congestion and discharge. It's used for sinus pain, postnasal drip, and mild ear aches. And homeopathy and nasal sprays for allergies, there are many. I'm just listing a couple here. Sanguinaria 200 if there's nasal and sinus congestion. Calcarb 200 can be used a month or two prior to the hay fever season to strengthen the immune system so that maybe the course of the allergies when the season then comes around is going to be lessened to varying degrees. And then allium cepa can be used as needed for sneezing. It's a little bit more symptomatic. And the dosages obviously need to be individualized based on the patient's specific presentation. And then at the office, we also have Beyond Links nasal spray and Zangärzte nasal drops. Those can be used to open up the sinuses and resolve the phlegm. And then also we can use white flower oil, which is great for, again, more symptomatic, not so much terrain oriented. But white flower oil, you just take a drop and put it right under your nose and just inhale, and it will open up your sinuses. It has a lot of very aromatic and fragrant herbs that will chase the phlegm away. So, and then, let's see, there's a case history. This is a female that came to see me some years ago, actually. Her main complaint was an allergy to cats and dogs, grasses. She'd had a chronic cough and a postnasal drip and chronic rhinitis. Since her husband had passed away a year and a half ago, she had never really gotten over that and had some, emotions around that. And so, so what we did is we did a combination of herbs and acupuncture and also some functional medicine protocols. And we worked on her grief issues, and I modified her diet, and we did some supplements for her gut dysbiosis, and then used a homeopathic remedy for grief. And after a few sessions, her cough and postnasal drip and rhinitis were gone. And then we continued to work on her allergies, and after a few months, she had a significant improvement. So she was a happy camper. So, so this is sort of how we address really any complaint, whether it's seasonal allergies or any other health problem. We always address what's going on for the specific person. In my upcoming free course series, I'm going to teach people about treating sinusitis, rhinitis, and postnasal drip. Things that you can do at home, things that can be useful. And I'm going to teach you about functional medicine, how to optimize your diet, Chinese herbal formulas, and homeopathic remedies. We're going to delve into some more details there. And there's a blog that I published recently on medium.com. And if you would like to be notified for the course module, you can click on this link and you will be opted in. And then when I'm ready to teach the course, you will be notified. To contact any of us, any of the practitioners, please call the office or use our contact form on our website if you need to set up an appointment. And we will look forward to hearing from you, and I hope you have a great day.